My name is David Rife. Good evening. I'm about to give a speech for the Fundamentals of Oral Communications class 111. This is a persuasion speech regarding organ donation. I am a dialysis nurse at Walter Reed National Military Medical Center. I've seen firsthand the need for kidney donors. The majority of patients I take care of who are on kidney transplant lists have been waiting for at least a year before getting the organ that they need. The hardships these patients must endure are difficult to comprehend. 4 hours in a chair every other day with fluid restrictions, diet restrictions, and the risk of blood loss while on the machine. Dialysis also can cause cardiovascular issues for our patients. Because their kidneys aren't functioning, they are unable to perform tasks that would seem normal for you or I. There is a great need for organ donation. We're going to go through what organs are. We're also going to discuss what organ donation is, why we need it, and why there's such a great need for organ donors in the United States. In order to understand why we need to increase the number of organ donors, let's discuss what organs are. Organs are a system of cells and tissues that perform a very specific function. Organs deteriorate over your lifetime. It's a natural fact. However, some people, because of either disease, genetics, or trauma, their organs stop working at a much earlier rate and deteriorate. Because of this, it can cause problems for those individuals. Some systems could be left alone, but if someone has a very bad heart, they could die. Sometimes we can actually do things to help save a patient. And we, like with dialysis, someone's kidneys have stopped working, we can kind of do the job that the kidneys do for a limited amount of time. Some patients are on dialysis 10, 11, 12 years, still waiting for organs, or they're not able to get on a transplant list. So there is actually a great need for organ donation. For the past 100 years, medical science has attempted to improve the quality of life of many patients by attempting organ donation. The best way to treat someone with a bad heart, bad lungs, bad intestine, no intestine, is to replace it with another body part from someone else. Same blood type, usually same tissue type, because that's the best thing for that patient. Yes, we may be able to treat it short term, but in the long term, 10, 15 years down the road, organs from someone else donated freely would be better. In 1905, rabbit kidney was inserted into a child who was suffering from acute kidney failure. It worked. It improved the kidney function for this young child, but the child ended up dying from complications of the surgery, according to HowStuffWorks.com. In 1954, the first successful living donor transplant was successful. One twin donated a kidney to his brother. It was the first time that this had ever been done, and it worked to perfection. Before this treatment, before organ transplants occurred, before dialysis was even invented, if you had kidney failure, you would die. Luckily, we have treatments that we can use. Since then, over 500,000 transplants have taken place. In most cases, transplant is considered the gold standard of care. We know what organs are, and we know what organ donation is. Well, actually, what does organ donation mean? In layman's terms, it's simply one person giving an organ to another. There are two different types of donations. Living donor, say, for instance, my wife or my child needed a kidney and I was a match, they could remove one and give it to them and it would work fine. The other type is a deceased donor. That is someone who has filled out a donor card and at their time of death, they procure the organs from that individual to be passed on to save someone's life. Usually with deceased donors, before they can even do anything, they must be declared brain dead. Brain death is a medical term that means the body is still living, but there is no brain function. There's no waves on what we call EEG, which they attach electrodes to different parts of your head, and the electrical activity in your brain gives off these little waves. They'll actually do one of those. They'll do an MRI and a CT scan to show that there's no brain function. Once that's been done, they can declare the person clinically dead, and then they can procure the organs, once again, to save someone's life. Why is there a need for organ donation? And how can someone become an organ donor? According to HowStuffWorks.com, there are over 98,000 people on organ transplant lists. Approximately 106 people are added daily. 18 people die every day because they can't get the organ they need. One organ donor, according to the National Institute of Health, can save or help make the life better of as many as 50 people. 50! Here's a list of organs and tissues that a person can donate to help save a life or to help someone's life better. Internal organs, such as the kidney, which is the highest in demand, liver, which is actually the only organ that can regenerate, the heart, the lungs, pancreas, and intestine. Other types of donations include skin for burn victims, bone marrow for patients who are suffering from leukemia, and corneas to help the blind to see. One person can help 50 people. All you have to do is register as an organ donor. It's a very simple process. But I recommend that if you do become an organ donor, let your family and loved ones know. So if something does happen to you, God forbid, you've already discussed your decision with them to make this an easier transition for your family. All you have to do is on your state ID, either driver's license or the state ID, you check a box that says you would like to be an organ donor. You can even specify what organs you would like to donate if you want to be very specific with it. By doing this, you can save countless lives. There are a lot of myths surrounding organ donation, and I'm going to lay out the myth and actual factual information to you right now. Myth number 1. Doctors will not save my life if they know I want to be a donor, which is wrong. The truth is, medical teams will do everything in their power to save your life. They have nothing to do with transplants. Their job is to get you well. They'll exhaust every means necessary to keep you alive. Only once they have exhausted all of those means will they begin looking to see if you're either cardiac death or brain death, and then let your family know to start making decisions on, we call it pulling the plug sometimes. Myth number 2. People can recover from brain death. I've never seen it done. I've been a nurse almost 20 years. Worked in ICU, pediatric ICU, ER. No one recovers from brain death. Comas, yes. I've seen many people recover from comas. But actual brain death, where there's no electrical activity in the brain, I've never seen anyone recover. So, that myth is also false. Myth number 3. Minorities should refuse to donate because organ distribution discriminates by race. Once again, no, that's impossible. Organs are matched by many factors: blood, tissue, and vary by race. So if you are of a minority and you need an organ donation, your best chance of getting the donation you need actually comes from your race. So once again, this myth is also false. Myth number 4. The rich and famous in the United States get preferential treatment. Once again, that doesn't happen. Donation recipients are matched by a computer database based on blood and tissue type, not how famous you are or how much wealth you have. Myth number 5, I'm too old to donate. Once again, this is wrong. People of all ages may donate. Physical condition, not age, is the most important factor. The actual transplant physicians will decide if your organs or tissues can be donated. Myth number 6, my family will be charged for donation. No. Your family will not be charged for your organ donation. The costs for the surgery to procure the organs that are needed actually go to the recipient of the organ donation. Myth number 7, donation will disfigure my body. No. Organ donation is a surgical procedure. You will always be treated with dignity and respect. It will not delay any funeral arrangements, and if you would prefer an open casket funeral, that can be done as well. The last myth, organs are sold with enormous profits going to the medical community. This is also wrong. United States federal law prohibits the sale or the buying of organs. Violators face criminal charges, including prison sentences and fines. The first step to saving lives is a simple check of the box. We can do so much to help those who need new life. As the transplant motto of Walter Reed says, don't take your organs with you. Heaven knows we need them here. You have all the information about organ donation now. What it is, why we do it, and why it is so vital that we have people donate. I hope one day that the need for organ wait lists will end, and that everyone who needs an organ can get one the same day the original fails. But until that advancement in medicine occurs, we need our organ donors. So please, please, do what you can do to help. Thank you.